Hey, I'm Dr. Sebastian Gonzalez from Performance Place Sports Care. Today we're going to do another evaluation on a knee, and this time we're looking at lateral knee pain, again to see if we can rule out meniscal tears, IT band or IT band syndrome, as well as a couple other injuries of the knee. So we're going to go through a typical exam and also use an ultrasound machine to confirm the diagnosis to make sure we're going the right direction for this person. So you're going to get to hear history, and if any of this resonates with you, then perhaps this is the type of exam you need. Okay, so why don't you tell me about how the knee is going and just point to where you feel it and how it feels and everything.
Okay, so the knee feels absolutely fine when I'm walking, doing any other movement besides running, and then when I'm starting to run at about a 4-minute mark, it starts to, I guess, radiate down to this section. I can't really pinpoint it,
yeah,
but it's around here.
Okay, so then why don't we just use some bony landmarks first. So this is the patella, this is the outer side. Does this bother you at all?
No.
Okay. And how about down into here?
No.
Now this is lateral joint line. Okay. Up into here. Does it bother you at all right now?
No, nothing at all.
Okay. So why don't we try we'll try some tests. Also, how long has this been actually?
This has been going on for approximately 3 months now.
Okay. What have you tried?
So I've tried release therapy, so needling. They've released like TFL, ITB, quads, hamstrings. Also tried strengthening my hamstring and my hip muscles, I guess, or glute muscles, medius particularly, and just starting to increase the running to maybe 1-minute intervals, and then that's about it at the moment.
Does that help to? Like when you take breaks, like you said, I heard it like 5 minutes or so, and then.
Yeah, so I can do like 2-minute intervals, rest 1, so walk 1, 2 minutes, walk 1, and I can only do about 4 or 5 of them at the moment. So approximately 10 minutes of running without pain all up.
Well, what does it feel like? Like an ache or like a burn? Like a?
It starts like an ache, and then it's probably a sharp pain. The further I keep going, I kind of stop now. I don't kind of push it.
Okay. Any numbness into this portion or the toes at all?
No numbness, no.
Okay. So we're going to test valgus and varus stress. So I'm going to test the outer components of the knee just to make sure. Let me know if any of these bother you.
Yep.
Is that good?
That's fine.
Okay. She says that feels good. Let's test the inner part. Feels good?
Yep.
Okay. Test for ACL. That's good.
Yep.
Okay. We'll test for like a possible meniscus. Just relax this knee in my hand. I'm going to let it bounce down. That's okay?
Yep, that's fine.
Okay. So just palpation as well. So this is the lateral joint line out here.
Just went off.
Oh, it's okay. Just I'll come back. This is the lateral joint line out here, which is really indicative of meniscal tears. It's around like, I think, 95% accurate. That feels okay?
Yep.
Okay. And then slide that around here just so you see the outer part of the knee. So right here is we're kind of bowing like the IT band. The attachment point is down here. I'm going to follow it up and just see if there's any tenderness about it. Nothing? Okay. Good. Let's have you press your shin into my hand. Okay. Good there?
Yep.
Pull in. That's good too?
Yep.
Okay. And just relax this knee. I'm going to grind the patella or the kneecap down. Feels good. Okay, so far what we're kind of ruling out roughly is going to be lateral meniscus tears, condylomalacia patella. We've muscle tested the quad as well as the hamstring. We haven't done anything really for the hip yet. We'll go through the ultrasound really quick to confirm and make sure there's no structural defects in the knee that we need to be concerned about. But I'm really thinking this could possibly be some type of referred pain from the from either the back or the hip, or we have an isolated muscle strain for some reason. But there's never any bruising, right?
No bruising.
Okay, so no bruising ever. Usually bruising would indicate like a grade 2 tear or something of that nature. So if it was a tear or a strain, it'd be like a grade 1, which in this case, if it's been 3 months, then we're looking at the possibility that this is already at a really good state where she can rehab it, or you can rehab it. Okay, so keep hold of that. You have an ultrasound, ever have an ultrasound before?
Oh yeah, it must have been years ago though. When I was like right into the triathlon scene.
When you were riding there?
I think they did it for a rehab.
Oh yeah, so there's
Might have been a.
Well, there's diagnostic and there's therapeutic.
Right. Yeah, I've never had diagnostic.
So the diagnostic ultrasound then, so we're looking at the tendons and bony structures and whatnot. So this, I'll show the video. So we have the quad tendon up here.
Yep.
We have the knee cap, the top part of it. Down here we usually look at the superior lateral recess of the knee and see if there's any major fluid coming out of it. There's really not, which indicates, actually this black right here, we're looking to see if that's inflated, and it's not. Usually that would mean some type of internal knee injury like an ACL, PCL, meniscus, something of that nature. Okay, so all that looks fairly clean. This is the patellar tendon. Right here it looks like a little freeway.
Oh, yeah, cool.
Yeah, and you follow it all the way down. This looks like it's the same width throughout. And then we can look into the window of the knee right here. This is the anterior or front side fat pad. I don't see any major issues in there, and I don't doubt we're going to see any vessels. Okay, so that looks pretty clean so far. Let's just confirm there's no meniscal tears or anything weird happening. Come on this side with that one. Good. So now we see in the picture there's the meniscus right there. It's a V shape right there, kind of where the arrow's at is at the tip of it. To me it looks like it's really it's like a nice triangle formation. I'll freeze it and crap. So it's a nice triangle formation right there. I don't see any like large amounts of fluid in and around it here, and I don't see it bowing up like this, which means it's all contained and nice, or at least it doesn't look like a fresh injury. It looks like there's possibly an old meniscus tear here. Did you ever have an old injury to the?
No, I think I have like maybe years ago, a little bit, yeah.
This just looks like it's kind of being pushed out of the joint space a little bit is all.
Yeah, I think I remember doing that actually, like when I was probably about 11 or something, just coming out.
11 years old, still hanging around. It doesn't look fresh.
No, it doesn't.
Okay, here's the outer portion of the knee. We're looking at the popliteal groove, kind of almost where that arrow's at, but more to the right. And then the joint space is on the right side, right there, right where that divot is. So far, this is a fairly abnormal ultrasound of the knee. Here you can tell again we're in the lateral meniscus because there's that pulsating artery right there, the lateral genicular artery. I'm going to scan up into the thigh here. The cool thing, you can actually see, you see how, so this is muscle. You can actually, so contract real slow, your quad. And relax. So you can see it kind of move.
That's cool.
Try it again. But it's got that nice like marbleized appearance. And relax, and here's like a, kind of like a fascia. So we're going to just investigate the thigh now. This is the femur. There's the muscles. Here's one muscle, here's a second one. And just seeing if there's anything blatantly sticking out in regards to like big pockets of black or like a big pocket of white. But right now everything has its like a nice kind of like marbleized appearance, like a good piece of meat.
Oh, cool.
Yeah. So whatever it is, in regards to the thigh and the knee, it's not a big deal.
Yeah, awesome.
So in case you're I wouldn't hit the panic button yet. So we should probably investigate how the hip works and how the trunk functions to make sure that there's not a contributing factor and making this thing become chronically strained and like a grade 1 strain anyways.
Would it like have anything to do with my the knee and the hamstring at all?
The question was the hamstring, would this have anything to do with the hamstring? So you had an old, was it a hamstring tear?
Yeah, 3 months ago, yeah.
Was it a bruise or was it just like a strain?
Yeah, a little bruise. No, they said it was between a grade 1 and a grade 2.
Okay, between grade 1 and grade 2. So let's see, let me grab you a towel. So between a grade 1 and a grade 2, I'd say there's a possibility, unless there was trauma. Was there trauma? Like you didn't fall on it or anything, or like
sprinting down the line.
Sprinting?
Went.
Okay, can you point to where?
It's about in there somewhere.
Go ahead and stand actually.
I think it was like down there.
Okay, so this is bruised at some point about 3 months ago?
Yep.
Okay, and you continued to play? Where were you?
No, it stopped, put me out, but I got back into slow jogging.
Yeah.
2 weeks after.
2 weeks after?
Yeah.
Were you jogging like, was it just, you can sit down if you want.
Yeah, just normal jogging.
Was it?
Jumped right back into it. So.
It felt normal?
Well, I didn't sprint or anything like that, so just slow jogging, so like a bit of walking. Took me about a week to walk properly again.
Okay. So here's what I noticed about so hamstring strains, and so the hamstrings they're a 2-joint muscle. Actually, here, why don't you stand? We're gonna do this for video. Okay, stay right there. So the hamstring is a two-joint muscle, or at least majority of them are. So they cross the knee and go all the way up to the thigh, and they insert into the ischial tuberosity right here. Okay, a lot of times hamstring injuries will happen from the landing phase or even overstriding with running, or an eccentric load or a lengthening contraction. But typically what happens is, I'm going to bring this hand to the side actually. So if we consider, let's say you got your pelvis is like a dial here. So you've heard of like anterior and posterior tilt and all that stuff?
Yeah.
Okay, so when you have a posterior tilt, let's just say the hamstring is attached to the bottom of this bottle. Okay, and it likes to be a certain length. It likes to be, like 2 feet long or whatever it likes. And then if you tilt this way, it changes the distance that it should be at. Yeah. So it makes it even more prone to tearing because it's beyond the length that it wants to be, or that it functions best at. So usually with hamstring tears, what I find is that this is kind of rotated. Yeah. Or there's some type of pelvis or trunk issue going on. Okay, so we're going to try a Sorensen's test just because I want to test the backside. Yeah. And see if the erector spinae and the glutes and the hamstrings can all work. So you're going to go face down here, and your belt is going to be off of the edge there. Okay. And I'm going to hold your legs. Righto. Okay, and we'll check time. I won't tell you how long it is. Okay. Just goes.
Face down.
So go all the way, this will be the end of the bench. Yep. Slide all the way off. So basically what you're going to do is see that position you're in right now? Yep. That's the one you're going to hold. Okay. And if you drop it all, I'll stop you. If it looks unsafe, I'll stop you. But you should hold it for as long as you can tolerate. Yep. And then we'll just see what the time is, but it's basically a blind test. Okay. So whenever you're ready, just cross your arms and then we'll start. Good. Let me know if anything hurts along the way and so on. So kind of what I'm looking for is to see if I don't know if we'll end up doing the other parts of the tests on you, but I usually test the trunk or the pelvis and the core in 3 planes of motion. So this would be one, this would be forward, backwards, but then it's resistant of forward flexion. So it tests the backside of your body. Everything should be pretty similar in effort level and in competency. So this should be, I guess, as easy as doing like a 2-minute plank for the recommended time anyways. So. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 81, 82, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 93, 94, 95, 96, 97, 98, 99, 100, 101, 102, 103, 104, 105, 106, 107, 108, 109, 110, 111, 112, 113, 114, 115, 116, 117, 118, 119, And for on the video, so this is called the Sorensen's test again. There's some good documentation on it. I'll put a link at the bottom to see if there's a place you can go, or to a reference where you can actually read the whole research on it, because it's a really interesting test, and I've actually found a lot of people, whether they're lifters or runners or not, actually a lot of people do fail it. Surprising too, because they did a study on deadlifting to see if these people are high risk of injury for deadlifting, when they were trying to rehab back pain anyways. And they found there was a certain number that most people should cross. Go and pick up a little bit. There's a certain number that most people should cross to be able to be low risk of back injuries while deadlifting. So I'll put that reference down there, and you guys could take a peek at it after you're completed with the video. Keep going. Come on, pick up. Okay, relax. So she dropped a little bit there. I don't know how'd that feel to you?
It was hard.
It was hard. Okay, so what I usually look for on this test is we look to see that it is about 3 minutes. There's something deficient in your ability to hold yourself against flexion, because with running you're going to be bending forward, right?
Yeah.
There's some type of forward lean with running. So I think so far that's something that would be highly suspicious in regards to the trunk,
Yeah.
as being a contributing factor on this. I didn't see anything wrong with the actual thigh musculature, and I didn't see anything wrong with the knee itself. So I would suggest we start investigating the thigh and the trunk more so, and then I'm sure you're doing time foam rolling and all that kind of stuff down here, right?
Yeah.
Down the knee.
Yeah.
So I would just kind of cut all that out and figure out why that thing is getting overloaded excessively.
Yeah.
I'll take you through a series of tests. I won't tell you how long they are. It's going to be blind testing for you. I want the effort level to be pretty much the same as what it was on that last test we did. So I'm going to be testing the trunk in 3 motions. It'll be forward, backwards, or 3 planes. Rotate, and then side to side. Okay? So first one, we'll just do a standard front plank. I'm not going to really give you too much coaching on how to do it, except for go from the elbows, make yourself as flat as a piece of wood, and stop when you want to. So go ahead and try that. We'll take you through the whole test, and then we'll keep an eye on the time, okay? Okay, flatten down a little bit for me here. Okay, good. So now we'll keep an eye on the time. If you guys on video are bored with this part, just keep fast forwarding through to where you see us change positions. But we gotta make sure to go through the whole test. What is your activity level?
Activity level prior or at the moment?
Like what you normally do. Like what is like a typical like workout week, just so we know that.
Typical pre would be.
Oh yeah, pre.
I've been running about 70, 80 Ks for the last, I don't know,
Ks.
10 years.
Gosh, what is that miles?
What's that, David? Miles? 70 to 80 K miles.
Oh, a week? 50 miles
about
a week?
50 miles a week.
Okay.
With about 3 to 4, maybe either CrossFit sessions.
Okay.
Or strength sessions. At the moment, post-injury, just been doing a bit of functional fitness, so high intensity plus strength workout.
Mm-hmm.
So most days of the week, 5 days a week.
Okay.
No running.
What was your what was your deadlifts and back squat weights and front squat weights?
Maximum deadlift would be about 80 Ks, which is
175 pounds.
175 pound, 1 RM.
Okay, let's flip, actually. Next test, you passed that one.
Oh.
Okay, so next one, side plank here, top leg on the in front. Press the ground away, flat hand. I want the hand on the hip, Okay, and so then tell us it was your back squat, front squat weight.
Back squat, about 80. Oh, for a back squat, yeah, probably 70 to 80.
Okay.
Front squat, about the same, 70. I haven't done that for a while though.
Okay. I was just curious because I'll let people know of, because I've actually had people come in that are, like, they lift a lot of weight, you know, like, but they don't always pass these basic tests, which when you scale it, you know, like, you should be absolutely just crushing these tests, you know.
Yeah.
Because your trunk should be stable if you're pushing that amount of weight, like, safely. A lot of runners actually don't pass this. I've been surprised the amount of types of people that actually pass this, or where they're deficient at. A lot of people are deficient on that first test we did, that Sorensen's test. Side planking is really tough for people, you know, but if you're going to be pushing weight, I think these responsibly should be the first things you should be able to just absolutely just murder. Okay, let's flip sides. So we always test bilaterally just because, or both sides, because we want to see how even she is or is not. Yep, go front foot on top. Put up heel to toe, there you go. There you go, perfect. And also too, in regards to form, just keep in mind, because I know there'll be some professionals watching this video and they'll say, that's not a proper side plank, he's not cleaning up form. And yeah, I get it, but sometimes we're looking at how the person moves and what their natural tendencies are first. And if I were to train this to clean things up, I would train it a different way. So this is just purely a test. We're trying to limit as many variables as we possibly can. So what I see is, at least on both sides with the side plank, to me it looks like she's struggling sooner than I would anticipate. Being able to have the lifting capacity and the running capacity. But David told me your what was your marathon time? Like 3 hours or something?
Yeah, 3 hours.
So 3 hours, so you got a good engine and everything, and I would expect more out of these already, at least so far. Okay, go ahead and stop. Next one, I like to test a single leg bridge. Okay, knees together, extend one leg. I don't care where you put the arms as long as they don't help. Drive up and hold. Should be flat as a board. And if you cramp at all, then that's a stopping point too.
Okay. Is that all right, feet?
Yeah, just as long as the knees aren't. I don't want to see like this on one side and this on another. Just kind of holding the same height. There you go. And if you guys are interested at all on the times that I usually shoot for on these things, I'll post them as well. Or we do have an article that you can check out. So notice on one side if it's harder on one side or another, because we're going to do the other. Okay, next. So those look okay. Next is, we call it a torsional buttress. Hands and feet just above the joints above it. To start, then you got your width proper about you. I'll just show you what the pass and fails are. Think about a hot cup of coffee on your back. Mm-hmm. If it spills at all, then you failed, basically. But you're going to go like this. Hold for 10 seconds is a pass. A failure is, or even opening up at the hip is a common one. Okay, so you get 2 tries per side. Just straight up pass fail. Okay, so she's got some hip opening on the right, so try the left side. This is for rotational stabilization. So there's some opening there still. Let's try the other. This time really keep the belly button down on the ground. I've seen much worse, I'll tell you that. surprisingly, people almost fail this like 75% of the time and relax. Okay, so those are the test.
Yeah.
And I'd say, here's the rough numbers we're looking for. For plank, we're looking for about 2 minutes. And these are numbers that I just ran by some strength coaches. I didn't look up a bunch of studies on them, but we said, is this all fair, like comparable in hardness? And they said, yeah.
Yep.
So 2 minute plank, 1 minute side plank, 30-second bridge, or single leg bridge, torsional buttress is the one you just did. And the Sorensen is 3 minutes. In the Sorensen, you hit like 115, I think.
Yeah.
So comparably, that's the one that looked really weak to me.
Yep.
And considering you can deadlift and squat and all that, those are challenges because when you fail forward, so they should be strengthening the backside. And it should really challenge your posture to keep upright with running and keeping the pelvis in position and all that jazz, which will then correlate to any of the 2 joint muscles which cross. The rectus femoris, the hamstrings in the back, the adductors, and now we have a whole complex of the leg which could be starting out. So I would clean the trunk stuff up,
Yep.
and then I think this will start to improve.
Yep.
Because I don't see anything structurally wrong there.
Yeah, it's good, eh? Well, that's good.
Yeah, this is much better than I mean, if you had like a tear there or like a meniscal fray or something like that, it'd be much worse.
Yeah, exactly.
Hmm.
So it's good. It's just like strengthening, really, isn't it?
Pretty much. I mean, it's just diligence. Like you can do it like, I mean, like I've seen studies that do like 4 to 7 days a week of doing trunk stabilization, and then, but the thing is, like, you can do it on the ground at first, which is a good starting point, but eventually you got to go to like half loaded and loaded positions, like kneeling, and then you end up doing it with like squatting and deadlifting and all this other stuff. So
Yep.
it's just a scaled approach.
Yep. Yeah, cool. So just those holds, like the ones where you're grabbing my legs,
Those are ones you can do.
trunks.
Bird dogs are a good one to do. So she asks, is the Sorensen is a good one to do? Yeah, it is. You can also do it on they're on an RDL at the gym. You can also do Supermans. You can do isometric hamstring stuff. There's a lot of variation of stuff you can do. But well, just to finish the video before we go to any more questions, then is basically we're looking at the possibility of the trunk being more stable than it could be, and which is going to rotate the pelvis, change the orientation or contact points of the muscles of the thigh, which is creating some thigh issues. So that's where I'd go with this. I don't know what diagnosis that would be, but that's how I would try to work through this right now.
Yeah, fantastic.
Okay?
Yeah, that sounds good.
Good.
Awesome. Thank you.
If anyone has questions on the video, feel free to actually comment below and subscribe to the channel. I'll answer all the stuff on the podcast or on a video and share it. So hope this helps. Take care.